Hi, my name is Neha, and I'm a resident physician at the University of California, Davis Medical Center. I'd like to take this opportunity to tell you why, in my perspective, effective communication in the form of writing is so important. On the PowerPoint slide, you can see that there is multiple ways by which physicians, doctors, and anybody really in the hospital uses communication in terms of writing to kind of convey how patients are doing, how they're progressing, and in their opinion, what are the recommendations for a patient going forward. So the first one that I've listed is progress notes. So progress notes are written by everybody in the hospital, really, that has part of the care in a patient's stay. So that includes physicians, nurses, dietary, physical therapy, occupational therapy, pharmacy, and the list goes on and on. In the hospital, it's such a collaborative setting that you're working. You're working with so many different professions, so many different people that are caring for this patient, that it's really important to know how the patient is progressing in the form of all of those aspects. In addition, obviously, you have a lot of physicians of different specialties also taking care of a patient. So their updates are all going to be in the form of these progress notes that are inputted into the electronic medical record system. So it's really important, as you can probably tell, that these notes be succinct, concise, to the point, and something that's very easily understandable by all the specialties and people that are taking care of the patient. Another type of communication method are things called sign-off reports. So sign-off reports are given to the physician that's coming on to service or the nurse that's coming on to service, at the end of a shift change so that they can take over care for that patient. Now, as you can imagine, that it's very important to kind of convey properly through notes or through sign-off reports that how the patient is doing, how they're responding to treatment, if their mental status is changing, if they're worried about anything during that shift, if there's anything that the nurse needs to follow up on in a couple of hours or a physician needs to be called about, if something changes. And, one person can't be there 24/7. And I know this firsthand. So many patients often, get upset that why am I seeing so many different doctors or so many different nurses throughout my stay here? They don't really know what's going on all the time. And that's where that effective communication in the form of writing really comes in, because you can't just be calling people and asking the progress of a patient. It's all in the electronic medical record system, and everybody has access to that. So that's why it's so important for those notes and for that documentation to really be there in a way that makes sense to everybody. And the third thing that I have listed is discharge summaries. So discharge summaries are extremely important. These summaries give a very good update to the next time a patient gets admitted, and you can go back and see from that summary what happened during the previous hospitalization. What were the outcomes, how did the patient respond, what worked, what didn't work, what things should they be worried about if a patient is readmitted. So discharge summary is very key. If I was admitted to a hospital in Michigan and then they did a whole workup for something and then I got admitted again for similar symptoms in California, instead of repeating that entire workup, it would be nice to be able to go to a discharge summary and kind of see what's been done already, instead of wasting millions of dollars in taxpayers' dollars and kind of doing the same whole workup over again. So those are kind of three big things that are very important and we use on a daily basis in the hospital in terms of writing and communication. I'd like to share with you one story in particular which kind of exemplifies why communication is so important and what can actually happen if there is poor communication between physicians, between nurses, and between residents. So this was an experience that I had at Kaiser, which is another hospital that I work at. And what had happened is a patient was admitted to the ICU team, and they were admitted for pneumonia. They were undergoing respiratory failure, couldn't breathe. They were intubated with which basically is just a tube down your throat to help you breathe, attached to a machine. And the patient was getting a particular type of medicine called propofol. And that medicine has some side effects, obviously, like most medicines do. And we watch the triglyceride number to see if the patient is having that side effect. Triglyceride and also another enzyme level. And the enzyme level just kept on increasing to the point where we thought, okay, this patient might have a reaction to this medicine. I don't think we should be giving this medicine to the patient. So we stopped it. And it wasn't me in particular, but it was another one of my colleagues that had noticed this. So she said, stop the medicine, and she just told the nurse to stop it and not give it again. So she left. It was the end of her rotation. She left and she went on to another service. The next day, someone else came on, and they weren't really aware that this medicine actually was harmful or may not agree with this patient. So they started again, and nothing was noted at first, but overnight, when the resident had left, the nurses kept continuing to give this medication. This medication calms the patient down, so the patient was very agitated, anxious. They kept giving this medication. And then the blood pressure started dropping, the respiratory status started dropping, so they started breathing very slowly. They started becoming a lot more short of breath. And the next morning, the patient, when we came back in, the patient was actually expired. So they had passed away, and they checked some of those enzyme levels at the end, and they were in the thousands. So this was very, very strong evidence that the patient's death was most likely due to this adverse effect of this medication. And what this story, although it's extremely, extremely sad, what it really teaches us, and in a very sad way, is that how important it really was for that initial person to write somewhere, in some way, shape, or form, in the chart, in the electronic medical record, write it in the allergy section, update some section with bold red underlined letters that this patient is allergic or potentially has something called propofol infusion syndrome and can die from getting excess of this type of medication. Unfortunately, that was just never really done, and a lot of people could have done it, but it just wasn't thought of, whether it was the resident, the attending, the pharmacist, the nurse. All these people kind of thought the other person would do it, or that it was already in the notes, but it wasn't in any of the notes. It wasn't ever written out explicitly. It might have been said, but never written out explicitly. So that kind of just goes to show how important it is to be thorough, concise, and effective in communicating whatever the patient's status is, allergies, response, outcome, through progress notes, discharge summaries, and sign-off reports. I hope that was helpful, and thank you so much for allowing me to kind of share my perspective in terms of effective communication in the medical setting. Thank you.